Did you know that rheumatoid arthritis can silently attack your heart? You may think that rheumatoid arthritis is just a joint disease, but did you know that this autoimmune disorder can also severely impact your cardiovascular system over time? In this video, I will reveal the shocking ways rheumatoid arthritis inflammation puts your heart at risk and what you must do to protect yourself. Let's begin.
Rheumatologistoncall.com.
Hi, I'm Dr. Diana Girnita, a board-certified rheumatologist treating rheumatoid arthritis and other forms of arthritis every day. When most people hear about rheumatoid arthritis, they automatically think of joints, the swollen knuckles, the painful knees. And yes, joint symptoms are what typically lead patients to see a rheumatologist like myself for diagnosis and treatment. However, many patients do not realize that the same underlying inflammation that attacks the joints can also silently inflame and damage other areas of the body, including the heart and vessels. Did your rheumatologist discuss about these potential complications with you? If not, it is crucial to understand the connection. Rheumatoid arthritis causes systemic inflammation that can directly affect the heart muscles, the artery linings, and other vessels. This inflammatory process promotes atherosclerosis or hardening of the arteries, raising the risk of heart attacks and stroke. The inflammation can also weaken the heart itself, leading to heart failure over time. Rheumatoid arthritis medications like prednisone or NSAIDs or non-steroidal anti-inflammatory medications can increase blood pressure, cholesterol level, and increase other cardiovascular risk factors when they are used for long term. So, in this video, I will explain to you how exactly rheumatoid arthritis affects your heart and, most important, how to minimize the risk. The number one complication is coronary artery disease. Yes, patients with rheumatoid arthritis have an increased risk of sudden death and heart attacks. The ongoing inflammation increases the risk to develop premature atherosclerosis, and that will increase the risk to develop heart attacks at a younger age. Even the long-term use steroids or certain NSAIDs like ibuprofen or diclofenac will also increase the risk for heart attacks. So if you are over 50 years old, have rheumatoid arthritis, and you are having chest pain, go to the emergency room to be evaluated. Even at a younger age, it's best to be proactive and go to the emergency room if you develop any symptoms like chest pain, shortness of breath, or severe fatigue, or even nausea or vomiting, because they could be a sign of a heart attack. If you start treatment early and it's aggressive enough, for example, treatment with methotrexate or biologics, then the risk for coronary artery disease decreases significantly. Then it is good to control other risk factors like stop smoking, control the blood pressure, control your weight, and the glucose. A few years ago, the FDA put a black box warning for JAK inhibitors to be avoided in patients with a history of thrombosis or coronary artery disease. So if you previously had a heart attack, you better not use these drugs because they might not be safer. The number two complication is heart failure. It appears that patients with rheumatoid arthritis have also an increase in the risk of heart failure. And this can also be caused by the excessive inflammation, but also the use of certain medications like steroids or NSAIDs. There are some studies that report worsening of the heart failure in patients using TNF inhibitors, but this is still under debate at this time. There are even more rare complications like the inflammation of the cardiac muscle that we call myocarditis, atrial fibrillation, which is a heart rate irregularity, inflammation of the lining of the heart that we call pericarditis. Rheumatoid arthritis inflammation can also affect the vessels and increase the risk to develop deep venous thrombosis or DVT, where dangerous clots form in the deep veins, usually in the legs. It also covers pulmonary emboli or pulmonary embolism when those clots break and travel to the lungs, and that can be life-threatening. Studies show that patients with rheumatoid arthritis have an increased risk to develop venous thrombosis when compared to other people in the general population. The risk appears higher within the first year of rheumatoid arthritis diagnosis and for those that require a hospitalization. As I said, certain medication used to treat rheumatoid arthritis may also play a role. The JAK inhibitors like tofacitinib, baricitinib, or uptadacimab, they have been linked with higher risk for thrombosis. Now, how to prevent these heart complications? The most important thing is to prevent them. If you have been diagnosed with rheumatoid arthritis, you should discuss it with your rheumatologist and get treatment as soon as possible, because as long as your inflammation remains untreated, the higher risk will continue for you to develop more complications. And if you develop heart complications, you will need to see a team of doctors, such as a cardiologist or a heart doctor, who will collaborate very closely with your rheumatologist. It is also important to have other risk factors controlled, like smoking, so stop smoking. Treat the high blood pressure, the high cholesterol, the high glucose, the diabetes, and address your weight. Remain physically active and avoid obesity. As we discussed, certain medications, if they are used in excess or for a long period of time, like steroids or certain NSAIDs, and I said before, ibuprofen or diclofenac, can also increase the risk for heart disease. So minimize the use of these medications. And if you have a history of heart disease, avoid taking JAK inhibitors, like I said before. If you have heart failure and you need to use TNF-alpha inhibitors like Humira or adalimumab or Enbrel or etanercept, stay in very close contact with your rheumatologist. If you have rheumatoid arthritis and if you are looking for a rheumatologist, or if you need to be evaluated for rheumatoid arthritis, my company, Rheumatologist on Call, might be of great help to you. If you are a resident of one of the US states that we serve, you can book a consultation because we are very happy to help. Our approach is personalized, very comprehensive, and we combine a holistic approach with the traditional medicine. I hope this video was helpful and it will enhance your knowledge about rheumatoid arthritis. In this way, you will make an informed decision about rheumatoid arthritis complications and the treatment. And if you have any comments, please don't forget to leave them in the comment sections below. Don't forget to like, share, and subscribe to my channel to learn more about rheumatoid arthritis and other autoimmune conditions. Until the next time, stay curious, stay strong, and stay informed. Thank you.
Rheumatologistoncall.com